Is there something about ME-CFS that can cause symptoms that are normally considered purely psychiatric, like anhedonia or a lack of emotional affect? If you're following a neuroplasticity program, should you follow their advice never ever to research your illness? And is there something about ME-CFS which might actually cause the body to break down its connective tissue, something totally irrespective of whether or not someone has Ehlers-Danlos syndrome? Hello, my name is Patrick Usher, and I'm an ME-CFS patient and author of the book Understanding ME-CFS and Strategies for Healing. And in today's video, I'm going to be answering 3 very interesting questions from members of my treatment and research support community. Now, obviously, I'm just a patient. I am fumbling around in the dark, just like anyone else, trying to understand these very complex conditions. But I do have some thoughts on all 3 of these questions, and I look forward to sharing them with you today, and also to reading your own in the comments. So the first question is, what can fix anhedonia, that's lack of pleasure, lack of affect, which is the capacity to have emotional expression, emotional facial expressions, and apathy in ME-CFS? I have tried all the mainstream psych approaches, such as ADs, RTMS, ketamine, psilocybin, neurofeedback, psychotherapy, etc. Do you think IVIG could help at low dose? Or maybe tick-borne and vector-borne infection treatment? I think it's not necessarily a psych issue, and a lot of treatment-resistant patients are actually probably suffering from immune system and other problems causing their symptoms. So the first thing I would say about this is that ME-CFS, by its very nature, which is a biomedical illness which affects the body systemically, will also affect the brain. And in particular, it will affect the brain through a reduction in blood flow, often very substantial, and also through creating a large amount of neuroinflammation. Now, these 2 things together will change how the brain actually works. And it is my view that a lot of the symptoms that may be thought of as purely psychiatric in ME-CFS are in fact simply a consequence of a brain that is not able to function as well as it was before it became sick. If the brain is getting less blood flow, if it is inflamed, a natural extension of that will be the creation of these kinds of symptoms. I think the person who's asking this question is spot on. These are not psychiatric issues. They are in fact a response to the illness. Now, this is an area which actually needs more research, but there have been some very interesting papers in the last few years which actually draw kind of links between schizophrenia, which often has these symptoms of lack of emotional affect, and apathy and anhedonia, which are kind of so-called negative symptoms of schizophrenia, i.e. symptoms which are defined by the absence of something, and ME-CFS patients. What they actually found is that people who scored higher on fibro-fatigue scales tended to have more symptoms of schizophrenia, particularly the negative symptoms. And the kind of general thrust in those papers was to suggest that there may be something immune, some kind of inflammatory response or problems in leaky gut that's causing an immune response, which could be contributing to the creation of an inflamed brain, and therefore actually these kinds of psychiatric symptoms. Now, this is all very hypothetical, but I previously came across a paper from all the way back in 1936, which measured the blood volume of schizophrenics. And to my knowledge, even though modern day studies have shown reduced blood flow in the brains of schizophrenics, this is the only paper that ever actually studied the total blood volume of people with schizophrenia. And what it found was that they actually had a reduction of about 20%, which is exactly the same as you would often see in ME-CFS. And that has led me to wonder, some people, and again, I say this is very hypothetical, it's very theoretical, I'm not saying this applies, this is just a thought, but that some people with schizophrenia or diagnosed with that actually have ME-CFS, and as a result of having ME-CFS, their brain is really struggling and starting to malfunction and create the kinds of symptoms that you would see in schizophrenia. I am someone who, since I became ill, has struggled with some of the symptoms that this person mentions in their question. I have developed a flat emotional affect. I find it very difficult to be spontaneous emotionally. I often have to act in a way that I think would be appropriate given the conversation, because I'm no longer capable of producing the kinds of responses that I would have been able to before I became ill. And my belief is that this is essentially, as I say, a response to the illness. Now, the question that this person also asks is, what can you actually do about it? And obviously, I don't have a straightforward answer to that. If I did, I wouldn't struggle with these issues myself. What I can say, and what I have noticed, is that as my ME-CFS does better, so too do these symptoms do better. So if I have a period of time, let's say 10 days or 2 weeks where I don't crash and where I've kind of gone into a better state and I'm really allowing that healing energy to build up, I notice that I also start to feel psychologically much more myself, much more able to engage, much more, kind of sociable, jokey. It just naturally seems that as the ME-CFS situation improves, so too does this kind of component. Similarly, I have found when I consistently practice some form of neuroplasticity, and the exercises I do are more things I've kind of developed myself to do with directing the brain away from traumatic thoughts and just focusing on more neutral or positive topics to kind of de-traumatize the brain by helping it to remember what is normal. Or I also go through periods of practicing different forms of meditation. But if I do those things consistently, I also notice that I feel more myself emotionally as well, and more able to engage and be kind of spontaneous. So my feeling is that in answer to this question, it very simply is that these symptoms will go away if someone recovers from ME-CFS. The person specifically asks about doing IVIG, or infusing healthy autoantibodies to modulate the immune response, or treatments for things like tick infections. And again, from my perspective, the answer would be if someone has issues with autoantibodies that have been found to be the case through testing, if someone has issues with tick problems or other infections, then absolutely it makes sense that treating those issues could improve the psychological situation, because you would lift a significant amount of the burdens which are driving the ME-CFS. And I know that there are people who have done immunoabsorption therapy, which removes the autoantibodies, who within a couple of weeks have said they felt like they were reborn and a totally new person, and they felt like themselves again. Similar stories exist for people who did the Berlin Cures treatment, which also targets the autoantibodies. So the second question is, what advice do you have for people who wish to pursue neuroplastic approaches in parallel with addressing physical dysfunctions? It seems like all of the neuroplasticity programs discourage/forbid thinking about illness topics. But unless you're at the beginning of your ME-CFS journey, the medical treatments you are likely to be considering/pursuing likely require a lot of research/planning/decision-making to execute. Is it fundamentally incompatible to do both in parallel? Is there a way to be balanced? So this is another great question, and I have quite a few thoughts on it. The first thing to say is that the reason why these neuroplasticity programs suggest this approach, that you shouldn't ever research your illness or think about it, is because most of them, not absolutely every single one of them, but most of them believe that the only problem in ME-CFS is a hypersensitive nervous system, and therefore that anything that might kind of keep you stuck in an anxious or traumatized state, such as frantically researching your illness, is likely, it perpetuates the nature of the condition and therefore can keep you sick. Now, the main problem with this approach is it's complete and utter nonsense. It is not the case that ME-CFS is only a hypersensitive nervous system. So the first thing I would actually say in response to this is not to feel like there's any need to actually follow the advice of those who really do not understand what's going on in ME-CFS. And for someone to actually maintain ME-CFS is only a hypersensitive nervous system, you would actually have to have never read any of the research into the illness. So these are people who are not actually making an effort. They are making assumptions. They perhaps use brain retraining to recover themselves and assume it must work for everyone else. And so the whole framework from which this is coming is actually something that you can very reasonably just discard, and without feeling any guilt about doing so. Now, having said that, it is true that there is an autonomic disturbance in ME-CFS. It's happening for a range of reasons. Many of them are actually to do with the various dysfunctions that develop in the illness, like the autoimmunity, the low blood volume, microclotting, cellular issues. All of these will actually freak out the brain and nervous system in their own right. But I do also believe that there is a maladaptive neuroplastic state, which is, part of the condition. It is true that if you are engaging in a lot of anxiety-related behaviors, that you could actually heighten the autonomic dysfunction. However, having said that, there is no rational or logical or common sense reason reading research papers or learning about an illness or learning about treatments would pose any risk whatsoever to the nervous system going haywire, as long as that work and research is done in a way which is curious, interested and generally calm, because it's just, in that sense, it's just learning, it's just education. And it would be like saying that, someone would be ill from learning anything at all, that, sitting down to read about some, the Second World War or something would make someone ill. It doesn't make sense. It's rather really, I'd say, about how you do it. So from my way of thinking about it, if you're engaged in a neuroplasticity program, the exercises you're doing should be, if they're, kind of working on the nature of the problem, they should be making you calmer, more able to actually be resilient towards stresses, and kind of more able to go through life in general in a more balanced way. And so if you're doing those exercises, you should naturally find that when you come to think about research, you come to think about what treatments you want to try, it should actually be from a place not of panic, but of interest, curiosity, and from a position that's actually quite reflective. And I cannot see any problem with that at all. And furthermore, contrary to what a lot of these brain retraining programs say, there are plenty of people who have recovered from ME-CFS using biomedical approaches, which will have absolutely had to involve a lot of research, a lot of study, a lot of thinking about the illness in a very direct way. And so it's simply demonstrably false that this should prevent someone from recovering in and of itself. And as I say, it is in fact coming from a deeply misguided perspective on what ME-CFS is. And so because of those assumptions, they then draw the conclusion that even thinking or researching the illness will keep someone sick. This is not true at all, and actually it's very important to have a full understanding of your illness so that you can apply treatments that can help you to make progress and to move forward as part of a multilateral strategy, which can hopefully one day get you over the finishing line. The third question is, I guess I'm wondering about ME and connective tissue issues. I know having Ehlers-Danlos syndrome, for example, will make you more prone to developing ME or POTS, but there seems to be something about ME itself too that weakens connective tissue over time, at least in a subgroup. As someone who struggles with neck instability and probably thoracic outlet syndrome, I'm wondering what that mechanism could be, and of course how that can be interrupted or reversed to prevent further worsening of these issues. Now, this is a really interesting question, and it's something that I've actually thought about a lot myself. I don't have an answer to it, and I actually think that researchers don't have an answer to it either. There have been some maybe noises or movement towards grappling with this. It is my own feeling, just as this person themselves believes, that there is actually something about ME that may trigger problems with connective tissue. And I think for a long time the narrative has been that people with connective tissue problems in ME-CFS also happen to have Ehlers-Danlos syndrome, which is a genetic, condition which causes the loss of connective tissue, hypermobile joints, joint dislocations, and so on. But I'm really not sure about that. I think there may be something about the nature of the condition which, as the body is struggling so much, actually the body starts to deprioritize the production of collagen, or there may be some pathomechanism which is in place which makes it kind of not occur. I have seen doctors Kaufman and Ruhoy on their Unraveled podcast make this exact point, that they too think there's something else going on, even though they don't know kind of what it is. And it's very important that we do get to understand it, because, as this person was partially alluding to, it does lead to these other problems with neck instability and, thoracic outlet syndrome or other problems, which then create further burdens on the body that make it harder to actually move forward. And I know that, there's been some research, including by the Visser and Van Kampen from the Netherlands, and also by the Swedish group, with Bragi et al., looking at the fact that people, with connective tissue problems in ME-CFS tend to be worse off. They tend to be more ill and struggle more, for example, with orthostatic problems, because when you have stretchy skin, the blood vessels are not as supported as they need to be, which then creates, further issues when you actually stand up. Now, this is a very interesting question from my perspective as well, because, I've been ill now for 7.5 years. I developed stretchy skin as part of having ME-CFS. So, here you can see this is what I actually look like, which is slightly unnerving, but that is what happened. And what's curious about this is that people who know my story will know that I was ill the first time in 2014 to 2015, and then I recovered for 3 years. What's interesting about back then is that in 2015 I also noticed that I had developed stretchy skin. It wasn't as bad as it is now, but it was definitely not normal. However, when I fully recovered, I just kind of one day was pulling out my skin again, and I saw that it had gone completely taut again. There was no stretchiness. It was completely normal. And so something about, recovering from the conditions I had, POTS, MCS, fibro, and probably ME-CFS to some extent, though it wasn't the main thing. Something about that recovery actually led my body to produce collagen normally again, which makes me think, if I were to manage to recover this time, could the same thing happen? Could the skin actually go back to normal? I don't know. It's an open question. But if in principle there's actually something about ME-CFS which can cause this, rather than developing Ehlers-Danlos, and I don't have joint dislocations. I do feel like my body is a bit more wobbly than it was before. It's not as together, but I don't have dislocations. I don't have, subluxations or anything like that. But if the ME-CFS goes away, could whatever the pathways are that have created these collagen issues, could they actually reverse? I know that a paper recently by Rob Vust et al. And I don't know enough about the pathophysiology or physiology of collagen to know whether there is some connection from this. But they found that the bodies of ME-CFS patients were depositing collagen in the blood vessels.
Brain. But in the long COVID and ME patients, it looks like these capillaries are sort of clogged up with collagen 4. So after quantifying, we indeed saw that the basement membrane was significantly thicker in both long COVID and ME patients, as well as a reduction in the lumen space.
Which is not where it should be. It's causing fibrosis and scarring and further worsening blood perfusion problems. But it made me wonder, is there some way in which the body is kind of shuttling off this collagen to the wrong place, whereas actually it should be kind of, being produced where it should be produced? I don't know. I have seen some people, say that they improve from kind of the hypermobility and the stretchy skin. And the people I've seen say that have tended to be following a carnivore diet, sometimes also following neuroplasticity. I've not seen them say that they fully got better from these problems, but I have seen them say that they have got substantially better. And so, that again at least shows to the possibility of a trend towards improvement. And some of those people had really bad, dislocations, and they really were, they had neck braces and everything. And then they actually managed to improve from that, thanks in the main to following a carnivore approach. This is a question that really needs to be thought about, I think, a lot more, because it would be helpful for people to know what can they do in order to, actually improve the collagen issues, or to know that if they recover, there's a high likelihood that these problems could go away. I did ask Dan Neufer, who, I think runs a very balanced neuroplasticity program, ANS Rewire, and he's followed a lot of people who recover. And I asked him, with people who have the connective tissue issues, what do you see? Do those issues go away or what? And in his experience, they don't go away, but the people can fully recover from everything else and go on to lead a completely normal life, as long as it's not very high intensity, because there's still some stress actually being placed on their body in terms of the vascular system not working out very well, which does remain a risk factor for triggering the condition. So that, was his perspective. So unfortunately, I can't answer this person's question about, what can be done to improve the collagen production, other than, as I say, it may be the case that recovery can help. And there is some evidence that people who have, that I come across anecdotally, listening to podcasts or YouTube channels, where people have improved this problem through adopting a carnivore diet. I have not, I don't have an answer otherwise. There was something I saw once maybe about manganese playing a role. I know there's also the Cusack protocol, which is specifically developed for Ehlers-Danlos patients, but I don't actually know if there's been a kind of attempt to follow up with how people do specifically with these more obvious manifestations of hypermobility and collagen issues. So that's it for the first Q&A video from questions from my Patreon Discord treatment and research support community. If you would like to join the community and ask your own questions for future videos, please check out the links in the description box below.